Good morning, students. In today's lecture, we would be discussing about the remaining cartilages of larynx, that is the epiglottic cartilage, arytenoid cartilage, corniculate cartilage, and cuneiform cartilage. So, the epiglottic cartilage is a leaf-shaped cartilage placed in the anterior wall of upper part of the larynx. This is the anterior side of the larynx, and this is the posterior side. So, it is placed in the anterior wall in the upper part. Two ends हैं epiglottic cartilage के, upper end and lower end. The upper end, as you can see here, the upper end is broad and it is free. It is not in connection with any other structure. It is free. And it projects upwards behind the hyoid bone and the tongue. So you can see in this figure, this is hyoid bone and the epiglottic cartilage, the upper end, the free end, broad free end is projecting behind this hyoid bone. And यही वो लोकेशन है जहाँ पे पोस्टीरियर मोस्ट पार्ट ऑफ द टंग कनेक्ट होता है टू द एपिग्लॉटिस विद द हेल्प ऑफ मीडियन ग्लॉसो एपिग्लॉटिक फोल्ड. The lower end is also known as thyroepiglottic ligament. It forms a pointed thyroepiglottic ligament and इसको thyroepiglottic बोलते हैं because it connects the epiglottic cartilage with the thyroid cartilage. So it is attached to the upper part of the angle between the two thyroid cartilage laminae. The attachments, the anterior surface is attached to the tongue with the help of median glossoepiglottic fold and also with the hyoid bone with the help of hyoepiglottic ligament. And the right and left margins are connected with the arytenoid cartilage with the help of aryepiglottic folds. So in this figure you can see the right and the left margin is connected with the arytenoid cartilage. This is in blue is the arytenoid cartilage. Next is the arytenoid cartilage. So the arytenoid cartilage is a pyramid shaped cartilage, 2 in number. They lie on the upper border of lamina of cricoid cartilage. So this is the pyramid shaped arytenoid cartilage and the location of arytenoid cartilage is on the, this is the cricoid cartilage, this is the upper border of cricoid cartilage. So it lies on the upper border of the lamina of the cricoid cartilage. There are two parts to the arytenoid cartilage, the apex and the base. As you can see here, this is the apex and this is the base. The apex is curved posterior medially. It articulates with the corniculate cartilage. So apex articulates with corniculate cartilage and the base articulates with upper border of the cricoid lamina. So you can see here in the figure, apex articulates with, in this purple is the corniculate cartilage. So apex is articulating with corniculate cartilage and base is articulating with the lateral part of the lamina of the cricoid cartilage. This is the base and this is the apex. There are two prolongation of the arytenoid cartilage. One is the anterior prolongation, which is known as the vocal process, and another is the lateral prolongation, which is the muscular process. Also in this figure also you can see the vocal process, which is the anterior prolongation of the arytenoid cartilage, and the lateral prolongation is the muscular process. So you can see this is the muscular process, which is towards the lateral side, and on the anterior side you have the vocal process. Next is the corniculate cartilages. The corniculate cartilages again 2 in number. They are small conical nodules that lie on the apex of the arytenoid cartilage, or they articulate with the arytenoid cartilages. They are also directed posterior medially. This is the posterior side, this is the anterior side. So they are directed posterior and medially towards the medial side. If you can see the pointed portion of the conical portion of this corniculate cartilage, it's facing towards the middle side, midline. Location is they lie in the posterior part of epiglottic folds. So this is the posterior side and they lie in this epiglottic fold, which is formed by combination of the arytenoid and the epiglottic cartilage. Last cartilage is the cuneiform cartilage. Again, two small rod-shaped pieces of cartilage placed in the epiglottic folds just ventral to the corniculate cartilage. So with the help of this model, we can understand the location of the cuneiform. They are ventral to the corniculate. So this corniculate is on the posterior side and this would be ventral, to more close to the anterior side, more close to the tongue side. These are the cuneiform cartilages. So that's all about the different cartilages that form the larynx. Thank you so much.